Vertie ethics in heeltekare ethies wen heeltekare professionals vaste ethical decisions. Ty often as kiestionslike wat sout I do. Or wat riele applicere. Vertie ethics begins with a different kiestion interlei wat kind of persoon sout ebbe. Vertie ethics is an ethical approach that emphasizes moral character rather than reales or consequences. In heeltekare ethics, it focuses on the cultivation of vertieus traits such as compassion, integrity, honesty, empathy, and practical wisdom that guide ethical behavior across a professional lifetime. Rather than asking whether an action maximizes outcomes or follows a reale, vertie ethics asks whether an action flows from a good and well-formed moral character. Ethical practice from this perspective is not primarily about isolated decisions, but about what the clinician is bekomend trouw gerepeated choices, habits, and professional formation. Vertie ethics is most closely associated with Aristotle, who argued that ethics is about human flourishing and the development of excellence of character over time. For Aristotle, verties are established dispositions, habits of thought, emotion, and action that enable a person to act well in complex and unpredictable situations. This insight is especially important in heeltekare, where professionals routinely face morele ambiguë scenario's that cannot be resolved by reales alone or reduced to outcome calculations. No code of ethics and anticipate every clinical content, every patient story, or every emotional nuance involved in gare. Vertie ethics recognises this reality. In heeltekare settings, ethical practice depends heavily on the character of the clinician. A compassionate nurse, an honest physician, or an empathetic therapist does not need to consult a real book at every moment to know of to respond to manually. Their moral perception has been sabed by vertie. This approach allegens closely with the of our heeltekare ethics framework emphasizes moral character alongside the normative principles. Compassion, integrity, and empathy are not optimal personality traits, they are ethical capacities that directly sape patient care. Compassion allows heeltekare professionals to recognize the suffering and respond with a genuine concern rather than emotional detachment. Integrity grounds ethical practice in honesty, consistency, and moral accountability, even when shortcuts are attempted. Empathy enables clinicians to understand patients as persons, not merely as diagnoses or causes. Vertie ethics also hegelig the relational nature of heeltekare. Ethical care is not delivered in abstraction, but trouw geongoing relationships between clinicians, patients, families, and colleagues. Trust, respect, and moral credibility emerge not from reales alone, but from the character displayed over time. From this perspective, ethical failures in heeltekare are often not just errors in judgment, but failures of character, burnout, eroding compassion, institutional pressure weakening integrity, or moral distress stilling empathy. Vertie ethics helps explain why ethical erosion often oskers gradually, not suddenly. Importantly, vertie ethics does not create reales or outcomes. Instead, it places them within a broader moral vision. Reales matter, but they are applied by people. Outcomes matter, but they are pursued by moral agents. Vertie ethics asks whether the person applying the reale or pursuing the outcome has the moral formation required to do so visually. This is weer practical wisdom, wat Aristotle called phronesis, bekomen central. Practical wisdom is the vertie that enables clinicians to discern the recht action in the recht way, at the recht time for the recht reasons. In heeltekare, dis means knoven of to balance empathy with the professionalism, honesty with the sensitivity, and decisiveness with the humility. Vertie ethics also plays a crucial role in professional identity. Heeltekare professionals are not merely technicians delivering services, they are moral agents interested with the profound responsibility over human vulnerability. Vertie ethics emphasizes lifelong moral development, mentorship, and ethical culture within heeltekare institutions. One limitation of vertie ethics is that it can feel less concentrated than real-based approaches. It does not always provide immediate answers to specific ethical dilemmas. However, it strengthens elsewhere in saping clinicians who are capable of navigating moral complexity with judgment, integrity, and care. This is why vertie ethics is best understood as foundational rather than exclusive. It indicates ethical decision-making by forming the kind of professionals who can responsibly apply principles, weige consequences, and honor duties. In heeltekare ethics, vertie ethics remens is that ethical practice is not just about doing the recht thing in isolated moments, but about bekoming the kind of professional patients can trust with their liefes, their bodies, and their stories. Understanding vertie ethics is essential because heeltekare ultimately depends not only on policies and protocols, but on the moral character of those who practice it.